My name is Helen Bulbeck. I'm Director of Policy and Services for Brainstrust, the Brain Cancer People. Brainstrust is a patient and carer-facing charity that was founded in 2004 after my daughter Meg was diagnosed with a brain tumour when she was 19. The day my daughter was diagnosed with a brain tumour, I reached out for help and there was none. We felt completely lost. So we founded Brainstrust after my daughter had brain surgery. She's in a good place now, but we just didn't want people to feel as lost as we did the day you're told you have a brain tumour. So we're there to support and grow the community. Brainstrust was founded in 2004 and I became aware that there are service delivery guidelines called the Improving Outcome Guidance for Brain and Central Nervous System Tumours, published by NICE. It's called the IOG in 2006. So I went to this to see what people should be expecting of their service, and it actually became quite a driving force for us because I realised that there were some clinical centres that weren't delivering on the service, and that's not a criticism, they just weren't able to have the resources that they needed. I was also quite interested in the multidisciplinary team approach because the reason we weren't offered any support or any treatment at all for my daughter was because in 2004 there was no such thing as a multidisciplinary team. So it was quite good to see that progression, that now that is the standard of care, that every patient would expect to have their case discussed at a multidisciplinary team meeting. So it was really important for me because we didn't want to duplicate, we have a finite amount of resources that are raised by our community fundraisers, so people shaving their heads, jumping off aeroplanes, doing wonderful and wild and wacky things for us, but it was really important to us that we didn't duplicate service. So looking really closely at the IOG and then getting under the skin of it, we were able to see, well, actually that bit of the service isn't being delivered, so that's where we could put our resource and focus our attention, and it was all about closing the gaps. So what we've done is taken the guidelines and just put what is the optimum standard of care according to the Improving Outcomes guidance, what the recommendations are at that particular phase, and what we think patients should be expecting. We've also put in there the questions we think they should be asking and other resources that they might want to go and visit. So it's been really important to us because, again, with the revised guidance now, we can still see, well, where are the gaps that aren't being filled, and we can go in, and it's called closing that social aspiration gap, the bits that the NHS, the bits that NICE can't do because it's not within their remit. It means that we can go in and focus our activity there and make sure that all the funds that are generated by our wonderful community are used efficiently and effectively, and we're not duplicating resources. But I think for me, as Director of Services and Policy, actually having these guidelines and engaging with clinicians and patients and carers brings me much closer to the patient experience, and it just makes it meaningful.